If you have noticed redness on your palms that does not go away, if the skin on your hands has developed an unusual color or texture, if you have seen changes in your fingernails that seem unexplained, or if the lines on your palms seem different than they used to be, stay with me for the next several minutes because what I am about to share could reveal that your liver has been sending you distress signals that you have been unknowingly ignoring. Signals that appear on your hands long before you feel sick. Signals that could help you catch liver problems while there is still time to reverse them. This is not about palm reading or fortune telling. This is about medical science. Your liver has almost no pain receptors. It cannot hurt to tell you something is wrong. So it sends messages through other channels. Through your skin, through your palms, through your nails, through visible changes that doctors have recognized for centuries as signs of liver distress. Changes that most people dismiss as aging or dry skin or nothing important. Let me make you a clear promise right now. By the end of this video, you will know exactly what your palms should look like when your liver is healthy. You will learn the specific changes that indicate your liver is struggling. You will understand why these changes appear on your hands and what they reveal about what is happening inside your body. And you will have a simple self-examination routine you can do today to check your own liver status. Not at your next doctor visit months from now. Today, in your own home. I am Dr. James Mitchell. For over 2 decades, I have examined patients whose hands told stories their blood tests had not yet revealed. I have seen palm changes that prompted further investigation and uncovered liver disease years before it would have been diagnosed otherwise. I have also seen patients who ignored these visible signals until their liver damage had progressed to stages that could have been prevented. The difference between these two groups was simply awareness. Knowing what to look for and taking it seriously. One of the most frustrating aspects of liver disease is how silently it develops. Your liver can lose significant function before you feel any symptoms. Blood tests for liver function often remain normal until damage is substantial. By the time most people are diagnosed with liver disease, they have already lost years of opportunity for early intervention. But your hands do not lie. They show changes early. They display what is happening inside even when everything else seems fine. So now I want to ask you directly. Have you looked carefully at your palms recently? Have you noticed any redness, color changes, or unusual textures? Have your nails changed in ways you cannot explain? Write your answer in the comment section below because this awareness is the first step in protecting your liver. And liver disease is far more common than most people realize, especially after age 50. Let me tell you about a patient named Margaret. Margaret was 62 years old and came to see me for something completely unrelated. She was concerned about joint pain in her knees. During our conversation, I noticed her hands. The palms had a distinctive reddish flush, particularly on the heel of each palm and around the edges. When I asked about it, Margaret said her hands had looked that way for years. She assumed it was just her normal coloring. I ordered liver function tests that came back slightly elevated, but within ranges many doctors would dismiss as insignificant. I ordered further testing. What we discovered was early-stage fatty liver disease that had been silently progressing for years. Margaret had no symptoms. She felt fine. Her routine blood work had never raised concerns. But her palms had been displaying a warning sign the entire time. Because we caught Margaret's liver disease early, she was able to make changes that reversed the damage. Her liver enzymes normalized. The fatty deposits in her liver decreased. And gradually, over months, the redness in her palms faded. Her hands had warned her. We listened, and it changed her future. Here is the question I want you to hold in your mind. What might your palms be telling you right now? And have you been paying attention? The answer could reveal something vitally important about your health. To understand why liver problems show up on your palms, you need to understand what your liver actually does. Your liver is not just a filter. It is a chemical factory performing over 500 different functions. It processes everything you eat and drink. It manufactures proteins that your blood needs to clot properly. It produces bile for digestion. It stores energy. It breaks down toxins. It regulates hormones. It manages cholesterol. When your liver struggles to perform these functions, the effects ripple throughout your body. Hormone levels become imbalanced. Blood flow patterns change. Proteins that maintain tissue structure become deficient. Toxins that should be eliminated accumulate. And many of these internal changes manifest externally on your skin, particularly on your hands. Your palms are especially revealing because they have unique blood vessel patterns and thin, sensitive skin. Changes in blood flow show clearly on palms. Hormone imbalances affect palm tissue visibly. Protein deficiencies alter palm texture and color. Your palms essentially provide a window into your internal chemistry, a window that has been available for you to look through every single day. Now let me walk you through the specific palm changes that indicate your liver needs attention. I want you to look at your own hands as I describe each one. The first warning sign is palmar erythema. This is medical terminology for red palms, specifically redness concentrated on the outer edges of your palms and on the fleshy pad at the base of your thumb. This redness is not from irritation or allergic reaction. It does not itch. It does not come and go based on what you touched. It is persistently present and becomes more noticeable when your hands are warm. Palmar erythema occurs because liver dysfunction causes changes in hormone levels, particularly estrogen. These hormonal changes cause small blood vessels in the palms to dilate permanently. More blood flows through these dilated vessels, creating the visible redness. This sign has been recognized by physicians for over a century as an indicator of liver disease. The redness of palmar erythema is different from normal palm color. Healthy palms may have some pink tones, but the color is relatively uniform across the entire palm. In palmar erythema, the redness is distinctly concentrated at the edges, while the center of the palm may appear more normal or even pale by comparison. Press on the red area, and it will blanch white, then quickly return to red when you release. This is a hallmark of the dilated blood vessels causing this pattern. The second warning sign is changes in palm creases. The natural lines on your palms can reveal liver status. In healthy individuals, palm creases are typically slightly darker than the surrounding skin. When the liver is struggling with anemia, often caused by liver dysfunction, these creases may become pale. Compare your palm creases to the surrounding skin. If the creases are notably pale or the same color as the rest of your palm, this may indicate a blood or liver issue. Additionally, some people with liver problems develop deeper, more pronounced palm creases. The skin seems to fold more dramatically along these lines. This can indicate protein deficiency, which occurs when the liver cannot manufacture proteins properly. The third warning sign is yellowing of the palms. This is different from the redness I just described. Yellowing indicates a buildup of bilirubin in the blood. Bilirubin is a yellow pigment created when red blood cells break down. Normally, the liver processes bilirubin and eliminates it through bile. When the liver cannot keep up, bilirubin accumulates and deposits in the skin. Yellowing often appears first on the palms and on the whites of the eyes, because the skin in these areas is thin enough to reveal the underlying color change. Many people assume yellowish palm color is just their natural skin tone, without realizing it has changed over time. Compare your palm color to the underside of your forearm. If your palms appear notably more yellow than your forearm skin, your liver may be struggling with bilirubin processing. The fourth warning sign is white or pale spots on the palms. These can indicate areas where blood flow is compromised or where the liver's inability to produce certain proteins is affecting tissue health. Some people develop patchy pale areas that contrast with the rest of their palm. Others notice their entire palm has become paler than it used to be. Paleness can also indicate anemia, which frequently accompanies liver disease. The liver stores iron and produces proteins necessary for healthy red blood cell function. When these functions are impaired, anemia develops and shows in the pale color of the palms. Let me tell you about another patient named Donald. Donald was 58 years old and came to see me because his wife had noticed his palms looked strange. She said they were red and mottled in a way they had not been before. Donald himself had not paid attention. He assumed his hands just looked like hands. When I examined Donald, I saw classic palmar erythema along with some spider angiomas on his forearms. Spider angiomas are small red spots with tiny blood vessels radiating outward like spider legs. They are another external sign of liver hormone imbalances. Donald's blood test showed significantly elevated liver enzymes. Further investigation revealed he had been developing cirrhosis from years of fatty liver disease he never knew he had. He consumed moderate alcohol and had always been told his drinking was not problematic. But combined with obesity and poor diet, his liver had been quietly deteriorating. Donald's wife saved his life by noticing his hands. If she had not spoken up, he might not have been diagnosed until his liver had failed to the point of no return. Instead, he was able to make dramatic changes that stabilized his condition. The fifth warning sign involves your fingernails. Your nails grow from the nail matrix, which depends on good blood supply and proper protein production, both of which are affected by liver function. Several nail changes indicate liver distress. Terry's nails is a condition where most of the nail appears white or pale, with only a thin strip of normal pink color at the tip. This occurs because the nail bed becomes pale from reduced blood flow, and the normal pink color from underlying blood vessels is lost. Terry's nails are strongly associated with liver cirrhosis and should never be ignored. Another nail change is the appearance of horizontal white bands across the nails called Muirche's lines. These bands indicate low protein levels in the blood, which occurs when the liver cannot manufacture albumin properly. The lines may appear and disappear as protein levels fluctuate. Clubbing of the fingertips, where the ends of the fingers become rounded and the nails curve downward, can also indicate chronic liver disease, among other conditions. This develops over time as oxygen delivery to the fingertips becomes compromised. The sixth warning sign is Dupuytren's contracture. This is a condition where the tissue under the skin of the palm thickens and tightens, causing the fingers to curl inward toward the palm. It typically affects the ring finger and little finger first. The palm develops thickened cords or nodules that you can feel under the skin. Dupuytren's contracture is strongly associated with liver disease, particularly alcoholic liver disease. The connection is believed to involve the same metabolic and hormonal changes that cause palmar erythema. If you notice thickening under your palm skin, or if your fingers seem to be curling inward and you cannot fully straighten them, this is a sign that warrants liver evaluation. The seventh warning sign is dry, flaky skin on the palms that does not respond to moisturizers. When the liver cannot properly process fats and produce bile, digestion of fat-soluble vitamins becomes impaired. Vitamins A, D, E, and K all require proper bile function for absorption. Deficiency in these vitamins, particularly vitamin A, causes skin changes, including dryness, roughness, and flaking. If your palms have become persistently dry and scaly, despite using moisturizers, and if this change seems relatively recent, your liver may be struggling with bile production or flow. This is especially significant if you also notice digestive changes like pale or floating stools, which indicate fat malabsorption. Now, I want to address something that complicates this topic. Not everyone with liver disease will develop palm changes, and some palm changes can occur for reasons other than liver disease. Palmar erythema can occasionally be caused by pregnancy, thyroid disorders, rheumatoid arthritis, or can even be hereditary in some families. Dupuytren's contracture has genetic components and is more common in people of Northern European descent. However, when multiple palm changes occur together, or when palm changes occur alongside other symptoms, the likelihood of liver involvement increases significantly. And the critical point is that palm changes often appear before other symptoms. They are early warning signs, not late confirmations. Let me share what can cause liver damage in the first place, because understanding causes helps you understand risks. The first major cause is fatty liver disease. This occurs when fat accumulates in liver cells. It is extraordinarily common, affecting an estimated 1 in 3 adults. The main causes are excess weight, poor diet high in processed foods and sugars, and sedentary lifestyle. Fatty liver disease often produces no symptoms for years while quietly progressing toward inflammation and eventually cirrhosis. The second major cause is alcohol. Even moderate regular alcohol consumption over years can damage liver cells. The liver processes alcohol as a toxin, and this processing creates harmful byproducts. Chronic alcohol use is one of the leading causes of cirrhosis and is strongly associated with the palm changes I described. The third major cause is viral hepatitis, particularly hepatitis B and C. These viral infections cause chronic liver inflammation that can progress to serious damage over decades. Many people with hepatitis C were infected years ago through blood transfusions or other exposures and do not know they carry the virus. The fourth major cause is medications. Many common medications are processed by the liver and can cause damage, particularly when taken long-term or in combination. Acetaminophen, the active ingredient in many pain relievers, is a well-known liver toxin when taken in excess. Some cholesterol medications, antibiotics, and anti-inflammatory drugs can also affect liver function. The fifth major cause is metabolic conditions, including diabetes and metabolic syndrome. High blood sugar damages liver cells directly. Insulin resistance promotes fat accumulation in the liver. People with diabetes have significantly higher rates of fatty liver disease and liver damage. Now let me share what you can actually do if you notice concerning palm changes. The first step is documentation. Take photographs of your palms in good lighting. Note the date. This gives you a baseline to compare against future changes. If you seek medical evaluation, these photographs help your doctor understand what you have observed. The second step is seeking proper evaluation. If you notice palmar erythema, nail changes, yellowing, or any combination of the signs I described, request liver function blood test from your doctor. Ask specifically for a comprehensive metabolic panel that includes liver enzymes AST and ALT, as well as bilirubin and albumin. These tests provide basic information about liver function. Be aware that standard liver blood tests can be normal even when liver damage exists. If your palm changes are significant, or if you have risk factors for liver disease, ask about additional testing. Ultrasound can detect fatty liver disease. More specialized blood tests can check for viral hepatitis. FibroScan is a newer technology that measures liver stiffness, indicating fibrosis or scarring. The third step is addressing modifiable risk factors. If you consume alcohol, consider reducing or eliminating it. Your liver may begin healing once the toxic burden is removed. If you are overweight, even modest weight loss can significantly reduce fat in the liver. Studies show that losing just 5 to 10% of body weight can reverse fatty liver disease in many cases. The fourth step is dietary modification. Reduce processed foods, refined sugars, and refined carbohydrates. These directly contribute to fatty liver disease. Increase vegetables, lean proteins, and healthy fats. Specific foods that support liver health include leafy greens, cruciferous vegetables like broccoli and Brussels sprouts, fatty fish, nuts, and olive oil. The fifth step is reviewing your medications with your doctor. If you regularly take acetaminophen, NSAIDs, or any medications known to affect the liver, discuss whether alternatives exist or whether monitoring should be increased. Never stop prescribed medications without medical guidance, but be informed about potential liver effects. Let me tell you one more story. A man named Richard noticed that his palms had become progressively redder over about 2 years. He mentioned it casually at a routine physical. His doctor examined his palms and immediately ordered liver testing. Richard's liver enzymes were elevated. Ultrasound showed significant fatty liver disease. But because Richard had noticed the change and mentioned it, his condition was caught before progression to more serious damage. Over the following year, Richard lost 30 pounds, eliminated alcohol completely, and changed his diet substantially. His follow-up testing showed remarkable improvement. His liver enzymes normalized, the fat in his liver decreased significantly, and gradually his palmar erythema faded. Richard now has normal-looking palms again. More importantly, he has a liver that has recovered instead of continuing to deteriorate. His hands gave him the warning. He paid attention, and it made all the difference. This brings me to the most important point. Your body is constantly communicating with you. It sends signals through symptoms, through visible changes, through sensations. Most people ignore these signals or dismiss them as normal aging. But often these signals are early warnings of problems that are still reversible. Your palms are one of the easiest places to check. You see your hands every day. You can examine them in moments. You do not need special equipment or medical training. You simply need to look with awareness and to take seriously what you see. For the next week, I want you to examine your palms daily. Look at them in good natural light. Compare the edges to the center. Check the color of your creases. Look at your nails. Feel for any thickening under the skin. Note any changes from what you consider normal for you. If you see signs that concern you, do not panic, but do not dismiss them either. Seek medical evaluation. Request appropriate testing. Understand that palm changes can appear years before liver disease becomes serious, which means early detection gives you time to intervene effectively. Anyone who tells you that palm changes are meaningless is not aware of the medical literature connecting specific palm findings to liver disease. Anyone who tells you that liver disease always produces symptoms is incorrect. Your liver can be silently struggling while you feel perfectly fine. Your palms may be the first indicator that something is wrong. I have spent my career helping people understand the messages their bodies send. Your palms are speaking to you right now. They reflect what is happening inside your liver with remarkable accuracy. The question is whether you will take a few moments to look and whether you will take seriously what you find. Your liver is irreplaceable. It performs functions no other organ can duplicate. Protecting it is protecting your life. And protection begins with awareness. Look at your hands today. Look at them with new eyes. They may be telling you something you need to know. The time to pay attention is not when you feel sick. The time is now.